I got this prescription from my primary, and it's called Pravastatin, 10 milligram tablets. Take them once a day. Well, how I got started on this is from a blood test. My primary said that your bad cholesterol is 101, and that it should be down to 99 at least, because that's what the insurance company wants. Everybody down to 99. So I had 1-2 points difference. I said, well, fine, give me the pills and I'll try it. So he gave me this prescription for Pravastatin, which is a statin. I guess this is a generic name, I'm not sure. So I took these for a couple of months, and I never had any follow-up blood tests, so I couldn't see whether it was effective or not. Then I went to see the primary again, and he forgot to order a blood test, so I went in there anyway. And he said, well, let's amp it up to 20 milligram tablets. I said, well, hey, I'll give it a try. So I got the 20 milligram Pravastatin tablets. And within about a week of taking 20 milligrams, which is twice the dosage I had before, I was doing a little exercise, and suddenly I've got a tremendous muscle ache in my groin. I never had that before, especially in that area, a muscle ache. So, and then, well, I took a couple more days, and then suddenly I got this massive headache, and it was right here. It's like near the jaw, but it's just boom, boom, boom. Well, I took some Tylenol on all the headaches I've had in the last 20 years. Tylenol or leave. I take one, and the next day it's gone. Well, I took it, and it diminished it, and then it came right back. The headache came right back. It's like, say, it's hardly a headache because it's in the jaw area. And I kept taking it again, continue with it. And I was also taking the Tylenol, and the Tylenol again would knock it down, but then it would come right back up. I did this 3 days in a row. I could not get rid of this pain in the jaw or headache because it's pulsing like a headache. And I said, you know, I read in the sheet about some of the adverse effects from Pravastatin or statins is this muscle pain and jaw pain. Well, I says, man, I said, I got to get rid of this headache. So I quit taking that 20 milligrams. I didn't take anything. And you know what? My headache, jaw pain went away. And I never had the muscle pain in the groin again. I said, whoa. I said, I can't, I'm not taking that 20 milligrams again. So I went back to 10 on my own. I'm not going to call him because I don't care what he says. This is what I want to do. I'm cutting back on the medication. So I went back to 10, and then I was doing some yard work, and I started getting severe groin pain. As, you know, I've never had this before. And then I got a pain again, this time directly in the jaw. And I was, you know, just hurting, opening my mouth, hurting. I says, you know what? I says, this statin may be a problem for me. So I cut back on taking that. I missed it for about 3 days. And that pain in my jaw went away, and I didn't have the groin pain again. Then I took it again, the statin, and then it started to come back a little bit. So I'm at the point right now, I'm taking like one every other day, 10 milligrams. But if I have any of those recurring symptoms again, I'm going to stop it. And whatever happens with the bad cholesterol level, that's just the way it's going to be. But This is my experience with a statin drug. Your experiences may not be the same. So check with your doctor first. But and also it said in there in the sheets that elderly people, which I am elderly, have more problems with statins.